Hello everybody, Dr. Gardner here with another fun-filled short video discussing potentially devastating medical conditions. Today's topic is ectopic pregnancy, which in simplified terms is a fertilized egg that decided to park in a no parking zone. Usually, this is a fertilized egg that implants in the fallopian tube. However, this ectopic pregnancy can implant in other locations. Sometimes you can even have a normal pregnancy in the uterus and a ectopic pregnancy in the fallopian tube, which we term a heterotopic pregnancy. Heterotopic pregnancies are a significant diagnostic dilemma, but for today's short video, let's just stick with ectopic pregnancies. In a normal pregnancy, the egg is fertilized in the fallopian tube, and then implantation occurs in the uterine lining. With an ectopic pregnancy, the egg is fertilized in the fallopian tube, but then it decides to go ahead and park there. Oftentimes, as this fertilized egg continues to grow, the patient will experience abdominal pain and vaginal bleeding. If this goes undiscovered, the ectopic pregnancy can then rupture, resulting in hemorrhage that is potentially life-threatening. As we start talking about the workup for ectopic pregnancy, remember that every female of childbearing age that presents with abdominal pain that still has a uterus should get a pregnancy test. Even if they've had a tubal ligation makes them less likely to be pregnant, but if they are pregnant, it's more likely to be an ectopic pregnancy. A female patient with abdominal pain, positive pregnancy test, and unstable vital sign should get emergent OB consultation because ectopic pregnancy has to be your primary concern. If their vital signs are stable, you can proceed with the normal workup. Once we have our positive pregnancy test, we can attempt a bedside ultrasound to see if we can find an intrauterine pregnancy. If we find one, we need to search for other causes of the patient's abdominal pain. If we don't, the search for an ectopic continues. Now we're going to need some additional information. A quantitative HCG, because that number might be important when we start talking about the discriminatory zone. A transvaginal ultrasound, because it gives us a better picture when we're trying to identify ectopic pregnancy. We may consider ABO and RH as well as a CBC, but we don't always need those. An intrauterine yolk sac is the earliest identifiable structure that reliably rules out ectopic pregnancy. With the transvaginal ultrasound, sometimes the ectopic pregnancy is easily identified. Other times there are findings that are suggestive of an ectopic pregnancy, like the ring of fire sign. And then there are other times when we don't find anything at all, nothing in the uterus, and no signs of an ectopic pregnancy. That's when the quantitative HCG becomes valuable. Now, these numbers vary slightly depending on who you talk to, but generally speaking, with an HCG level of 6,000, we should see a pregnancy with a transabdominal ultrasound. At a level of 1,500, we should see a pregnancy using transvaginal ultrasound. So, if we have a patient whose quantitative HCG is 3,500, but the transvaginal ultrasound shows nothing, the concern for ectopic pregnancy has to be high. One caveat to this is if the patient has had a miscarriage, but usually there's some ultrasound findings to suggest this, or products of conception to verify this. Remember when I said that you don't expect to see a pregnancy with a transvaginal ultrasound with the HCG level less than 1,500? Well, that's for a normal pregnancy. Ectopic pregnancies are not normal, so even at a level less than 1,500, you should order the transvaginal ultrasound to look for an ectopic pregnancy. If an unruptured ectopic pregnancy is discovered by ultrasound, treatment options include surgical intervention or medications such as methotrexate. Obviously, ruptured ectopic pregnancies require surgical intervention. If nothing is seen on ultrasound, the patient can be brought back in 48 hours for a recheck as long as the appropriate conditions are met. The HCG level is below the discriminatory zone, the abdominal exam is non-surgical, and they have stable vital signs. We know that in a normal pregnancy, the HCG doubles every 48 hours, so if at 48 hours it's going down, miscarriage becomes more of a consideration. If it's still going up, we have to continue looking for an ectopic pregnancy. Now you know the basics of ectopic pregnancies. Maybe next time we'll discuss that shopping cart that got left in the middle of the parking lot. I hope that you found this short video useful. It was my pleasure bringing you this educational material.